All right. Hello, everyone. My name is Tiara Brooks, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled, How to Secure MCO Contracts and What are the Next Steps that you need to know about to improve sustainability. But before we begin, we do have a few housekeeping reminders. First, please help us with our attendance count. Only if you are viewing as a group, please go to the chat window in the question box and type in the name of the person that is registered and the total number of additional people that may be in the room with you. For example, Tammy Jones +3. This will help us with our final attendance count. Also, all attendees are in listen-only mode. However, we would like to hear your questions. To ask a question at any point during the webinar, please use the question box located in your GoToWebinar control window. We will address questions following the presentation. Also, at the end of this webinar, attendees will be asked to complete evaluation poll questions. This webinar is being recorded and will be archived on our website in 3 to 5 business days along with the slides. Please also visit School-Based Health Alliance for additional archived webinars for such as the ones you are currently viewing on your screen. Now, I would like to introduce our presenters for today. Mary Saeed has 25 years of senior management experience with local and national insurance and managed care organizations, involved in NCQA and AAHC accreditation committees, providers network integrations, and product migrations for multiple mergers and acquisitions. She is also School-Based Healthcare Center's consultant for the past 5 years, providing guidance on MCO contracting, review, and sustainability process. And Rosalina has 11 years of senior management experience with local managed care organizations, experience in HEDIS, STARS, MRA, special needs plans, credentialing, policy and procedure, and compliance. Senior management team lead for NCQA structure and process and AAAHC accreditation committees. I would now like to turn it over to our presenters, Mary and Rosalina.
Good afternoon, and I am getting the slides open at this point. My name is Mary Saeed, and we're just getting the presentation on board, and now we show the screen. So, I'm so sorry. We're going to start with the agenda, which is how to attract attention to your school-based health to secure, negotiate contracts with the Medicaid managed care organizations, which we're going to refer throughout the presentation as MCOs. That'll make it easier. Coding and billing, knowing how to navigate the 3 main code sets in order to achieve correct funding and sustainability. Understanding HEDIS and how this impacts on your MCO contract negotiations and achieving higher reimbursement levels. And we're going to want to focus, and this is going to be, this goes in line with focusing on the School Health National Quality Selected Measures, and we did that for you this afternoon. So are you ready for your contracting? Have your provider's credentials ready for the MCOs. You should have data collection capabilities such as clinical reports, health assessments, patient encounter forms. You should have an EMR as well. The school-based health must be able to submit claims and encounter data to that MCO. And now that they are accepting and they're reimbursing for telehealth capabilities in rural areas, you should consider that, especially if you're in a rural area. However, there's other ways that you can use these telehealth capabilities, and of course our company can help you with that because they go beyond reimbursements. Issues like connecting with a parent as you're seeing the child while they're there at your school-based health center, and connectivity to certain specialists It's being used a lot here in Florida with dermatology, behavioral health counseling. So think about that. And now with the simplicity of it, it's not as convoluted or as heavy-duty equipment. You can actually connect again with the parents as you're seeing the child. So how to attract a Medicaid managed care organization to offer you a contract? As we mentioned before, you have to be ready with all those previous items. Your school-based health are providing services to their students, which happen to be their members. And they're similar or the same as what is required by the HEDIS benchmark when you see these children and you assess their health. So each state Medicaid program has the same HEDIS benchmarks. This is throughout the country. The MCOs throughout the country, they struggle with meeting these required benchmarks, primarily because of lack of participation and compliance on behalf of their members and or lack of reporting on behalf of the providers. As a school-based health, you have daily access to their members. This is huge. Your school-based health must be able to demonstrate your innovation, your services, the fact that you can measure data and outcomes in a compelling manner. So standardize your data to meet the coding and HEDIS requirements, which we're going to talk about in a few minutes. It is imperative that the school-based health prepares an effective presentation that conveys your data in a concise manner that demonstrates to those managed care organizations the ability to meet and exceed the health assessment goals that both the managed care and the school-based health have in common. If you emphasize by partnering with your school-based health, your students, which are the MCO members, will have increased access to care, and the MCOs, will receive more encounter data that will meet many of their needs, the HEDIS requirements. This, again, is a huge win for the MCOs, and it would also then complement you with the subsidies and of course getting paid for your claims. So your school-based health mantra should be standardize your data, better care, and greater sustainability, which I believe is part of your tagline and your logo. Have them tour your facilities. Feature your presentation and tell them your story. So how do you develop your story? We have two pieces of documentation that we're going to switch off of this presentation to show you. One of them is a toolkit that we worked on for the school-based health in Illinois. It really is a way to organize your presentation. If you answer the questions in the toolkit, and again, this will be provided at the end of the presentation, then you'll be ready to do your presentation. And then we're going to show you a sample presentation that we've completed. Okay, I'm going to go out now to the presentation, and we're going to go into the toolkit. Okay. I believe I thought I had it here, but I do not. Okay, so let's just show you the final presentation that I had and we completed for an actual school. I just changed the names so that we protect the PII or the HIPAA information. So once they completed the toolkit, which again, it's really just a booklet that asks several questions that will then, the outcome is what you're seeing here. Obviously, this is the mission statement for that particular school. And in detail, it is, it's indicated here, particularly let them know when you were founded and what your mission is. You can see here is a sample. The background of your school-based health is very important. If you're affiliated with another health system, an FQHC or a university, et cetera, et cetera. Your community partners are important. The carriers like to see this. If you're affiliated with the health department or a trust fund, you know, et cetera, any kind of foundation, feature it in your presentation. Your demographics is huge. It's a very important. It's such a simple thing that you may not even think it's important, but for the carriers, it's extremely important because they can see in this particular presentation that 75% of the children in this school were Medicaid eligible, and 33% of the population of 12,000 students were actually enrolled, and that is an eye-opener for them. And then basically categorize by the census, et cetera, et cetera. Most of our schools use the benchmark of free lunch as the tell-all for Medicaid qualifications. So that's a good indicator to use if you have that in your school. Go ahead and show that. And then, of course, what schools are you in, and show them the addresses and the locations. In particular of importance for them, this has always been a point of contention for the carriers. Well, you're a school, you're only open, you know, during school hours. If that's the case, that's what you're going to have to publish. This particular school-based health had hours in the evenings, as well as they opened up partially on Saturdays. So that was a big, big eye-opener for the carriers as well. So let them know that you're open, and when the hours that you're open, they need to see you as a provider, as a doctor's office. Let them know how you access your students, how they can access care, how they can go to your clinic, how they have permission to go see you. Obviously, this particular school has a consent form signed and notarized by the parent and gave them approval to go to the clinic. You know, basically in this particular school system, they had permission from the date that they enrolled in the school all the way through you know, this was a system that included elementary through middle school, so they were able to see the children as long as they stayed in the school health system by signing the permission once. So those are the things they want to hear, and they, you know, obviously if it's true, you want to let them know. The services you provide. In this particular case, these school-based health centers had all these services. But feature them. They don't know. They need to know this. And then what staffing do you have? So here they're going to look at, are these physicians or providers or nurse practitioners, or do you just have nurses? So they want to see who they can credential. And for a managed care organization, they can credential physicians and nurse practitioners or ARMPs or PAs. Unfortunately, registered nurses are much more limited, and they are not able to be credentialed by an MCO. Basic encounter data. This is not a fancy Excel report. We're not showing graphics here. But if you do have that in a more concise and fancier manner, go ahead and show them. But basically, these are things that you probably collect already. It's just a matter of thinking about them and putting them in a format where you can feature them and show it to the MCOs. I believe the BMI screenings is one of the things you've selected as one of your 5 measures as a school-based health collaboration. So these are the kind of things that they are looking for. And you can see what this particular school reported or showed in their presentation. And then some noted accomplishments. And program goals. Now, obviously, this was the goal for that particular organization. You may have different goals, but this is a good indicator for you to use. And it continues. And then, obviously, you know, this is a request for contracting effort, so we put that in the end. We're going to go back to the other presentation. And I'm going to turn it over now to Rosalena.
Thank you, Mary, and thank you all for having us here today. I'm going to talk about coding and billing and how to navigate the three main code sets in order to achieve correct funding and sustainability. So what is a code set? Medical data code sets used in the healthcare industry, including coding systems for diseases, impairments, other health-related problems, and their manifestations, causes of injury, disease, impairment, or other health-related problems, and what actions are taken to prevent, diagnose, and treat the managed diseases. Medical coding really comes down to knowing how to navigate the three main code sets. These code sets help coders document the condition of the patient and describe the medical procedure performed on the patient in response to their condition and/or injury. CPT. The current procedural terminology, or CPT, is a medical code standard for how medical professionals document and report medical, surgical, radiology, laboratory, anesthesiology, and evaluation and management services. All healthcare providers, payers, and facilities use CPT codes. They fall into three main categories. Category 1. These are 5-digit codes that have descriptors which correspond to the procedure or the service. So for example, a general checkup is coded as 99214. Category 2. These alphanumeric tracking codes are used for execution measurements. Using them is often optional. These codes end with an F. So for example, 2014F, which is mental status assessment. Category 3. These are provisional codes for new and developing technology, procedures, and services. The codes were created for data collection and assessment of new services and procedures. These codes end with a T and they have an expiration date. They could also be considered to transition into a Category 1 code, such as 0058T, which is the cryopreservation of reproductive tissue. ICD-10. ICD-10 stands for the International Classification of Diseases, and its codes hold critical information about epidemiology, managing health, and treating conditions. Healthcare professionals use ICD codes to record and identify health conditions. And insurance use ICD codes to classify conditions and determine reimbursement. So they offer accurate medical description to differentiate between risk and severity and distinguish symptoms of diseases. And they're efficiently used to reimburse claims. HCPCS, or Healthcare Common Procedure Coding Systems. These codes mainly represent medical supplies, durable medical goods, and non-physician services. And the services not represented in Level 1 code set. HCPCS Level 2 includes services such as ambulance, durable medical equipment, prosthetics, orthotics, and supplies when used outside of the physician's office. So why are these codes important? CPT codes work in tandem with ICD codes to create a full picture of the medical process for the payer. So for example, this patient arrived with these symptoms as represented by the ICD codes, and we perform these services represented by the CPT code. How does this affect your funding? Two incredibly important elements to billing and coding is namely the health of the patient or the member and how much to bill for those services. You want to ensure that you, the provider, is properly reimbursed for your services. Revenue-driven codes specific for diseases such as mental health and diabetes are imperative to maximize return on investment. It is estimated that doctors in the U.S. leave approximately $125 billion, yes, billion, on the table each year due to poor billing practices. This is a stark reminder of physicians not providing optimal patient care is only one of the big factors in becoming successful in this industry. How does it impact sustainability? Two of the most common factors contributing to a loss in profit. There's billing errors. It is estimated that up to 80% of medical bills contain errors. Insurance companies are very strict on correct medical billing and coding practices. And even the smallest mistake can cause an insurance company to reject a medical billing claim. Medical billing errors can cause a doctor to have to wait several months or more before receiving payment on their services. Failure to stay up to date on medical billing rules and regulations. These rules are constantly changing, requiring physicians and administrators to spend time and money on continuing education. Proper documentation and coding are paramount to correct funding and overall company profitability. So to recap on this slide, we talked about CPTs, ICD-10s, and HCPCS, and how those codes are important and how it affects funding and impacts sustainability. We are now going to move into understanding HEDIS and how this impacts an MCO contract, negotiations, and higher reimbursement levels. So what is HEDIS? HEDIS is the Healthcare Effectiveness Data and Information Set. It is a tool used by more than 90% of America's health plans to ensure performance on important dimensions of care and services. Altogether, HEDIS consists of 81 measures across 5 domains of care. Because so many plans collect HEDIS data, and because the measures are so specifically defined, HEDIS makes it possible to compare the performance of health plans on an apples-to-apples basis. HEDIS measures are specified for one or more of 3 data collection methods. Administrative method, that is data collected based strictly on claims. Hybrid method, data collected based on claims and medical record data. Survey method requires organizations to collect data through a survey and must be conducted at a health plan level through a third party. The measurement year is referred to January 1st through December 31st. HEDIS provides you with certain time guidelines to guide you for compliance. You do the work the measurement year, it gets collected the following year, and reported the following year. Collection period is from January through May of next year and is reported by the health plan in June of the next year. So for example, measurement year 2016, where we currently are in today, is from January 1st to December 31st. Data gets collected between January and May of 2017. All the data gets reported into CMS by June 2017 to give you stars and measurement benchmarks for 2018. What is Pay for Performance? The Pay for Performance initiative started as a means of aligning the interests of insurance and physicians toward the goal of delivering quality medical care. Under Pay for Performance compensation, physicians are rewarded for delivering care that meets certain benchmarks established by the payer organization. The benchmarks may take the form of a specific clinical care target, such as the control of blood sugar in diabetic patients, the use of appropriate preventive health strategies, such as screening for breast cancer or HPV, information technology compliance and enhancements, such as the use of electronic medical records, or administrative metrics, such as enhanced access to care or patient satisfaction. What can you do? Submit appropriately coded claims and counters data for each service rendered in a timely manner. Submit encounters electronically and work reject reports completely. Provide lab data as requested. Keep accurate, legible, and complete medical records for their patients. Help ensure HEDIS-related preventive screening, tests, and vaccines are performed timely in an appropriate manner. Allow access to or provide records as requested. This is important. Mary mentioned that with the technology today, it's so much easier for them to access your EMR system or your electrical medical records than to having somebody come into your site and retrieve the record. So with HEDIS, we learned about what it is Pay for Performance, the collection method, and what you can do. Moving on, these are the measures that the School Health Services National Quality Initiative. So the first one, as you can see, is chlamydia. Chlamydia screening, or CHL, as it is noted in HEDIS. The description is percentage of women 16 to 24 who are identified as sexually active and who had at least one test for chlamydia during the measurement year. Again, the measurement year is January 1st to December 31st of 2016. What this measure requires: must be identified as sexually active by a prescription such as contraceptive or a claim, and the screening must be done. And this is your code for the screening, Z1118. The reporting method is to administrative, which means you have to submit a claim in order to get credit for it, both you and the health plan. BMI, the percentage of members 18 and above who had an outpatient visit and whose BMI was documented during the measurement year or a prior year. So this is a good one. This is one that if you didn't see the patient in 2016, but there's something recorded for 2015, you can get credit for that, and that will be through the hybrid method. These are the codes that you can use depending on the ranks or on the percentage where the BMI falls. So if it's 19.4 BMI and that is considered normal, then you would do this Z code. Some of the other measures that were chosen were well child visit, or W34, which is members 3 to 6 years of age who had one or more well-child visits with a PCP during the measurement year. Another one is adolescent well-care visit, which is members from 12 to 21, which falls within your school-based membership or population. Annual risk assessment, this is one that was chosen, and it can also be combined with those physicals being done for the sports to be released into sports, and depression screening, which is your Z code, and it's also done yearly. These are some of the Medicaid performance measures that can also be used for the year, and it'll be good if you're able to capture it. You have the members there in the clinic, and you're able to capture all of these for the MCOs. These are some of the ones that they struggle with on a yearly basis because of the benchmarks. Like Mary mentioned, a lot of the members are not compliant due to the parents having to work one or more jobs, and they're not able to take them into the office, or they just call out sick, so they're not really consistent with the compliance of their child. Thank you for your time. At this time, we'll take questions. This is how you can contact us, emails and phone numbers.
Okay, at this time, we would like to ask if you have any questions, please enter your questions in the question box. And while we give others the chance to enter their questions, we do have just a few announcements also. All right, so the School-Based Health Alliance works to improve the health status of children and youth by advancing and advocating for school-based health care. Our members extend and support our work. Trainings like this webinar that you guys are attending would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. So please take a moment after the presentation to visit our website and our membership for information and to join. All right, and our call for abstracts is now open for our 2017 National School-Based Healthcare Convention in Long Beach, California. The deadline is quickly approaching, November 6th. So please visit sbhforall.org for more information. That is our brief announcements, and now we would like to give everyone a chance, if you have any questions, to please enter your questions in the question box. Now, we did have a few questions about the slides and the recording. I want to start off with that. I just want to let everyone know that this is being recorded, and we will offer the slides after the presentation. Okay, so Mary and Rosalina, we do have a few questions. Are SBHCs struggling with care coordination? How is health information between SBHCs and other providers being exchanged? Regional health exchanges.
So, okay, say the question again, please.
Yes. So are SBHCs struggling with care coordination, and how is the information between SBHCs and other providers being exchanged?
So basically, when the school-based health center sees the child, you want to know how you exchange it with another provider, or how the other provider exchanges it with you?
I believe that's what they're asking.
Okay.
Yeah,
so there's, obviously through an EMR or through the, obviously you send a copy of the encounter to either the specialist that you're referring the child to, and vice versa. If you have given that child and the parents directive to go see a dermatologist, that dermatologist, you should give it to them with some kind of a script. And the old-fashioned way used to be that where the doctor would write a letter and report back to you. Now they can email you or fax you directly, It's basic, basic exchange of outcomes of what they've done. So that's really how I'm aware that that's still being done today.
One of the other ways is when we discuss the HEDIS collection method is medical records. So if the carrier wants to come in to your site, you would have to be able to give them permission to go through those medical records and obtain the information that they require. So for example, for an HPV screening, if that's what they're looking for, you want to make sure that it's documented within the chart if it's a paper chart, or it's available for them in EMR. Obviously with EMR, it's a lot easier because they can do and access your reporting system remotely. So as long as everything is there and coded properly, they will be able to collect that data from you.
Okay, great. Thank you. Let's see. Our next question is, if the MCO is contracted with a third-party administrator, how does the SCHC bill through the MCO or to the TPA? For example, dental.
Dental in particular?
Yes.
Okay.
It depends who has the contract.
Right. It depends who has the contract. In other words, there could be a middle person, which would, in this case, I'm assuming it's going to be the TPA, who is administering the claims. So out of that comes a specific agreement between the school-based health, if that's the dentist that you guys utilize and send your kids, or maybe that dentist is working on site. There should be a contract between the school-based health center and that TPA, if the TPA is the one that's getting the actual contract from the MCO, to then reimburse the school-based health center whatever that agreement would be. In many cases, this is typical of an MSO, in where the primary care receives a per member per month amount, and some others contract with a fee for service. So you only get a fee when you actually provide a service. So it can go either way, either a per member per month based on all your attendees or patients at the center, whether they go or not, or a fee for service when they go and obtain services, they get the fee.
Okay, thank you. Our next question is, how are behavioral health services being integrated in SBHC? Are payers buying behavioral health services?
So when you do contract with your MCO, this is something that comes up a lot, and it's something that's absolutely, I think, imperative that is brought into the arena of the contracting efforts. For the most part, the MCOs have their own third-party company that does behavioral health for them. What I have seen typically in the school-based health is that when you want to access, the way the school-based health wants to access the mental health is obviously through their own social workers or their own, obviously psychologists in-house. So that would mean that the MCO would have to force that contract for that specific counselor to be contracted with that behavioral health entity that they work with. Or perhaps you may even be able to get a deal separately. But those are services that are reimbursable if it's the correct type of provider, such as a social worker with a counseling degree.
Okay, thank you. Is a capitation payment for a bundle of services ever part of a per patient per month payment between the SBHC and the MCO?
That's pretty typical of more of a Medicare kind of contract. Typically for Medicaid, which is what you're looking at, it's a per member per month, but it's a smaller amount. But there's always, when you contract with your MCOs and through your MSOs, there's always what they call bill above, and you should consider that. I don't know, depending on the facility, do you do lab work and x-rays and other services that you want to be literally you want to bill above and beyond that per member per month allowance or stipend that they give you.
Another thing is also what the MCOs can do is provide pay-for-performance programs where the doctors are meeting specific benchmarks, so such as they saw the member and they did do a BMI and they documented and coded it properly. So when the MCO gets the claim, then the doctor is already getting credit for that. So once they meet a certain threshold, like let's say they have to meet 75% of the membership needs to have the BMI done, then there's a certain pay for performance in addition to the cap.
Thank you so much. The next question is just kind of a little bit of a comment. It said it's likely easier for a school-based health center sponsored by a hospital or hospital system to implement some of the coding and billing and whatnot that you spoke about, and harder for standalone school-based health centers. Can you speak to
that? Yes, absolutely. I would kind of say it's yes and no, because even though you think those of the ones that are working through hospital systems may not even get the help that they need as well. I've experienced that. So, but the fact is, yes, the billing component is very important. It's critical. But honestly, it's obviously something that has to be looked at. You have to pay attention to it. I guess the good news is that you're performing more primary care services, so it is at least from this world of ICD-10s and CPT codes and all these codes, you will really get to a point when you start doing this, if you haven't already, and if you have, you'll be able to see that there's specific codes and that you're going to be using over and over again. So, initially, yes, it's a lot of work, and certainly we can help out with that with you guys and develop a menu of codes, and CPT and the ICD-10 diagnosis codes to help with that. But yes, you're right. It is tough, but once you get going, I'm assuming with the population you will be using the same codes over and over again. I wish I had an easier, better answer for you guys.
Great. And that was our last question. Is please feel free to answer any more, but Mary and Rosalina, would you like to add any additional information?
I just want to remind everybody that the learning, the billing, and the coding is the most important thing if you want to be successful, because you want to demonstrate what service you're providing for these children, and you want to show it off to the MCOs so they can take you seriously. You want to be sure that you are telling your story in that sense, because you want to take credit for all the array of services that you are providing, especially when they struggle so much to meet those benchmarks at a health plan level.
And this is Mary, at the point where you are trying to obtain those contracts. Again, it's imperative that you do have some kind of a billing system in place. If you can't, there's billing companies that should know what they're doing, that you can actually contract with and have them do your billing for you. And that may be an answer, because I'm telling you folks, you have the children at your disposal. These are the clients and the members that the MCOs cannot seem to get into the door or get the reporting or meet the measurements, and this is on a national basis. They are not able to meet those benchmarks simply because, like we had mentioned before, either the parents are too busy and they're not taking them to the pediatrician, they're using the emergency room for care, and yet those few children that are privileged enough to have a school-based health center right at their disposal are being seen, and you guys are taking care of them, and you're not getting paid for it. So this is huge for you and huge for the MCOs, and it's just a partnership that makes absolute sense.
All right, perfect. Thank you so much. Again, this is being recorded, and we will have it uploaded to our website in 3 to 5 business days, and we will also provide the slides and the toolkit that Mary and Rosalina have provided. But before we end, we do have a few questions for you guys. So our first question is, okay. All right, and please take a few seconds to answer the question. Okay, thank you, everyone. The next question is, was the coding and billing portion of the presentation helpful? If you can please take a few moments. Okay, thank you. Our next question is, with the HEDIS and how it impacts your MCO negotiations portion of the presentation helpful? Please take a few moments to answer the question. Okay, and this, thank you for answering the poll questions. And actually, we do have a couple more questions for you, Mary and Rosalina, if that's okay.
That's fine. We have time.
Perfect, since we're still within the hour. MCO pay for the startup of an SBHC?
Can you repeat that?
Sure. Would an MCO pay for the startup of an SBHC?
I don't know of any that have. My experience has been mostly through health systems such as universities or hospitals and foundations, or for example in Florida, the Children's Trust. But typically, if you do get donations and foundations to start up a school-based health, there are multiple entities, multiple foundations get together to do this. We, at one point in one of the states that I was working for, was helping to complete an RFP, which is an idea that whoever's asking this can probably do and put it out to bid to the community and see, you know, what response you get. You may have the private sector that may want to do this in conjunction with some non-for-profits. So that's another way of trying to do that. But MCOs, as far as I know, are not have not funded, that I'm aware of, the opening or the creation of a school-based health center.
Okay, and our final question, another question, which typical CPT codes and ICD 910 codes typically billed provided by SBHCs?
You can usually bill all the ones that correspond to all the initiatives that you have, the BMIs, the visits themselves, if you vaccinated the child, if you assessed them or gave them counseling for physical activity, mental health assessments. So there's an array of CPT codes that you can use per visit on each child. There's so many to name, because just as long as you get them in the door, you can actually take advantage, and whatever is done in that visit can be billed.
And remember that the billing entity must be a contracted or credentialed provider. So, for example, if you work in conjunction with an FQHC, there usually is a physician or a medical director that oversees the PAs or ARMPs at the school level. So it would have to be billed by a provider that is credentialed or credentialable. So a nurse cannot bill for services like for an office exam, for example. However, a PA or an ARMP can, or of course a physician.
Okay, and do you only bill to the MCO, or will you bill to the MCO's TPA providers?
Well, that depends on the actual contract you have and how they tell you, what they tell you, you know, how they tell you to work this.
Yeah. So you bill to either one of them. If it's the third party, then you bill directly, or you submit your claim strictly to the third party, and the third party takes care of submitting it to the MCO. If it's a direct contract, then you bill directly into the MCO.
Okay, perfect. That is actually our last question that we have today. Is there anything else, Mary and Rosalina?
No, thank you so much for having us.
Yeah. And any questions that you have, we'll be more than happy to help you and answer them.
Perfect. Thank you so much. And we have the contact information. You can contact School-Based Health Alliance on our website, or you can email or call Mary and Rosalina directly. As you see, their contact information is on the screen. And like they said, if you have any information, please do not hesitate to contact us. And we appreciate you spending time with us today, and have a wonderful day.
Thank you.